तो हम लोग को फ्लेल चेस्ट के ऊपर आंसर लिखना है। फ्लेल चेस्ट में बेसिकली two or more consecutive ribs fractures at two different sites, two or more consecutive ribs fractures in two or more places each. That is called as flail chest. The etiology can be a blunt trauma chest with multiple rib fractures. Now, the problem is paradoxical respiration. What is happening in paradoxical respiration? Inspiration, expiration. Inspiration, because while inspiring, the segment is not expanding. Because of this, there is impaired ventilation, decreased air movement in the lung, less air in the lungs. And during expiration, I have to write ki because of when it is collapsing, because there is internal splinting, so there is a lot of pain. So because of this, there is voluntary splinting. So you are not able to comment because of the lot of pain. So voluntary splinting is the word. So what happens is, because of these two things, impaired oxygenation and stiff chest wall movement, there is happening a lot of hypoxia, and because of this there is also a risk of hemothorax and a pneumothorax. Investigation is a CT scan, which is the gold standard, and the management initially was basically to internally splint the chest by mechanical ventilation. But now we think of about high flow oxygen and adequate analgesia and physiotherapy. If you have a chest tube in place for the hemo or the pneumothorax, you can give topical analgesia through the local you can give intrapleural local analgesia. Topical intrapleural local analgesia can also be introduced, and ventilation is only reserved for patients who are going into respiratory failure despite the analgesia and oxygen. And surgery to internalize the for the flail segment using internal fixation of the ribs may be useful in a selected group of patients. You can also do an internal fixation of the flail segment. Internal fixation of the ribs of the flail segment. Okay. Surgery to stabilize the flail segment using internal fixation of the ribs may be useful in a selected group of patients.